This time last year, we were beginning to feel the effects of the coronavirus pandemic. Shutdowns, quarantining, and mask wearing quickly became a strange new normal in fear of a novel virus. On the front line, healthcare workers witnessed the worst of it, especially those working in the ICU. I went inside one local hospital's ICU to see how the staff is holding up, what they've learned about caring for COVID patients, and their message moving forward. COVID-19 first felt like a faraway problem to respiratory therapist Jonathan Settles.
Starting to hear about it in, China and stuff. And so I wasn't too concerned about it at first.
But quickly, things changed at French Hospital.
You basically went to airborne precautions, which is one of the highest PPE kind of levels that you go to, because we didn't know what to expect.
Unknowns that were frightening to even seasoned nurses like Jennifer Neff.
It was scary at first. I mean, even being a nurse for over 20 years, I was scared.
The hospital's ICU director, Rose Bray, remembers bracing for a surge of COVID-19 patients.
We went ahead and just got ready on every possible level.
Nurse Michelle Constable has cared for some of the sickest COVID patients in San Luis Obispo County.
Certainly respiratory distress, if not failure. High fevers, altered level of consciousness, multiple days of lethargy, multi-organ failure.
Losing patients now an everyday reality for these everyday heroes.
Sometimes when you're driving home, you just start crying, and that's okay. It's hard not to get attached because there's just been too many that have passed.
But they soldier on. Before going into a COVID patient's room, Neff dons this special respirator because N95 masks don't fit her. A tedious process now.
I don't even think about it anymore. At the beginning, it was such a long process to do it. Now you just do it.
Once thought of as a last-ditch effort, the practice of proning or turning patients onto their stomachs is now done right away.
When you're flipped on your stomach, the backside of your lungs are able to expand. It's an intervention, I think, from the nurse's perspective. It's given us hope. I've seen patients improve on a ventilator just from proning.
We're constantly bringing new science in. Our unit's run by intensivists who are very, very aware of the new science, and we're trying everything we can to get these patients to survive.
Survival often hinging on the work of respiratory therapists and ventilators.
Simply put, this is life support.
The outcomes often unclear.
There's been moments where I was like, we're going to still do everything we can, but I don't know. And then all of a sudden, maybe a week, 2 weeks later, they're walking out and they're saying thank you.
Celebrating victories.
The day a COVID patient leaves the hospital, we'll do an honor walk where we'll line up and clap as they leave.
And processing all the loss. The ICU staff says COVID has bonded them.
They get it. They get what goes on here. My family and my friends, they don't get what we see back here. I'm thinking about how very hard my staff works. They're amazing.
Facing each day
I learned that I'm a lot stronger than I thought I was.
with grit and grace.